Hi, welcome to another episode of MedNiche Dr.B, and today we'll be looking at the neck and thyroid examination. So we'll be following this order, which is inspection, auscultation, percussion, and palpation. Okay, so let's dive into it. So basically, you're looking at your patient from head to toe. But before we even go in, what are the most important things you shouldn't forget to do before a physical examination? Your hands, washing your hands using the hand sanitizer, and also don't forget to introduce yourself to your patient. Okay, hi, I'm Dr.B, and what's your name, please?
Hello, Dr. B. My name is Billy.
Okay, how would you like me to address you?
You can call me Mr. Billy.
Okay, so Mr. Billy, I'm going to be doing the neck and thyroid examination on you today, and it's going to involve me touching you. Basically, we'll be doing inspection, auscultation, percussion, and palpation. Please do I have your consent?
Yes.
Thank you. So on inspection, we'll first of all start from the hair, and we observe, and we're looking at the hair for any sign of thinning. Now we go to the eyes, and interpret, can you look forward for me? And we're looking out for any signs of exophthalmos, bulging of the eyes, lead retraction, lead lags. And we also do the H test at this point in time. Please, could you follow my hand for me? Thank you. And at this junction, I'll also be checking my patient's mouth for hydration. Please, could you open your mouth for me? Okay. So you said your name is Mr. Billy, right?
Correct.
Thank you. I was checking for hoarseness of voice. No sign of that. Then we go to the neck itself. Please, could you give me head upwards for me a little bit? Good. At this junction, I'll be inspecting the neck. No sign of visible pulsations. Then checking here. No sign of jugular venous distension. No sign of asymmetry. No sign of thyroid enlargement. No sign of tracheal deviation. Also, I'll be checking for any sign of scars. Now, I'll also tell my patient, quickly swallow for me. Good. So, with swallowing, you observe that from the thyroid cartilage, cranial cartilage, and thyroid gland, there's a move upward. Now, I'll also tell my patient that, can you please protrude your tongue for me? Good. What am I observing from? Any form of movement. If there's a cyst there, if there's a lump there, a cyst, thyroidosity is noted to what? Move with protrusion of the tongue. Okay. Still on inspection, I'll tell my patient, please put your hand out for me. I'm checking for any form of peripheral tremor, which you see no sign of. So find tremors in this instance. Also, we check for the skin, any sign of dry skin, any sign of sweating. And also checking for any sign of pretibial myxedema. Okay, with these we are done with inspection. Okay, so right now we're moving on to auscultation. Now, there are three structures you'll be auscultating at the neck region. So we'll be auscultating for the thyroid bruit. Now, why? We observed that when it comes to the issue of thyroid masses, we see a case of increase in vascularity, so which we could get by listening for the bruit. So watch. Please, could you hold your breath for me? So the reason why we tell the patient to hold their breath is so that the sound of breathing will not intertwine with the breath. Then we can also check for the carotid breath. Bilaterally, and there was no sign of carotid breath. Then lastly, we also listening for the trachea. Now, why is that? Now, the trachea is one of the locations for normal breath sounds. So we'll be checking at the suprasternal notch. But note this. In a situation whereby usually trachea you should hear harsh, loud sounds, but in a situation whereby you hear some form of stridor or wheezing or diminished breath sounds, these are very important. Now, let's go. So I go for the jugular notch, just here, which is also called the suprasternal notch. Understand? Breathing out, breathing out. Thank you. And that's that. Then we do the percussion test, which is we are checking for any form of retrosternal extension of the thyroid. So basically, I go to suprasternal notch, just right, and then I percuss. Now, on normal, going to the sternal area, we expect to hear what? Resonance. But in a situation where we hear dullness, that signifies what? Thyroid enlargement, a mass, goiter going on there. Okay, then we go to palpation. Now on palpation, we have 5 structures we need to palpate for. So the first thing we palpate for is the carotid pulse. Now please, don't palpate your carotid pulse bilaterally at the same time. Nah, please don't. So we do this for 1 minute. Now, the heart rate is going to be what? 60 to 100. You check for amplitude, which 0 means what? No pulse. 1 means slow, steady pulse. 2 means normal pulse. 3 means what? Bounding pulse. Now, you also check for the volume. Is it a case of hypovolemia, euvolemia? And you also check for reading. Regular reading, irregular reading. Okay, now the next thing we palpate for is trachea. Now note one thing. So you have an idea, the location, and you also have an idea of where your sternocleidomastoid muscle is. So basically, all you do posteriorly, you check. Now, while palpating the trachea, on both sides, you look at the space between the SCM and the trachea. You do the same thing on the other side. So you're checking for the space between it. And so, it's similar. So there's no form of tracheal deviation. Also, you palpate for the parotid gland. Now this we do both externally and internally. Here, we're going to be doing externally on both sides. Well, I'm looking for any form of what? Enlargement. Now, lastly, we also palpate for the thyroid gland while the patient is swallowing and while it is not swallowing. Now, you could check either in front or at the back. So, I'm going to be checking from the back. Now this without him swallowing. So normally, the thyroid gland is a very soft gland, barely palpable. So you're checking for size, you're checking for shape, consistency. Now don't forget that when I tell him to swallow now, we're checking for mobility. Please can you swallow for me? Thank you. Noted. All right. Then lastly, we're going to be checking for the lymph nodes. So we're going to be palpating for the lymph nodes. So join me as you go. Don't forget bilaterally. Now, so we're going to palpate for anterior auricular, posterior auricular. Please can you look that way for me? Thank you. We're going to palpate for the maxilla. We're going to palpate for submandibular, submental. We're going to palpate for occipital, superficial, cervical. You're also going to palpate for the deep cervical. Now, you're also going to palpate for your supraclavicular lymph nodes. Now, what do you check while you're checking out for these nodes? Don't forget, you're checking for size. you're checking for shape. If it is tender, if it's inflamed, yes, and you're thinking lymphadenitis. Now, if the consistency is hard, you're thinking of malignancy. You're thinking, oh, is there any form of lymphadenopathy going on there? All these are important. Now, when you are done with this examination, you explain what you observed to the patient. So after doing the neck and thyroid examination, I observed no abnormalities. Thank you for coming. And with that, please don't forget to like, subscribe, comment, please, and share this video to more medical practitioners, medical students, anyone. This is going to be off with anyone. Thanks for watching and see you next episode. Bye. To your patient. Cartilage.